Nursing 474, Genomics and Public Health Nursing. Here again are the weekly learning objectives for week 3. And the second slide also pertains to the weekly learning objectives for week 3. The human genome and its transforming effect on public health. The mapping of the human genome was a strategic inflection point in the history of healthcare that created a massive shift in how all health professionals deliver care and how public health will be approached. Nursing is affected by various things: nursing student education, nursing collection, use of health history information, nursing knowledge, and the use of innovative biotechnology, role of genetics and genomics in traditional nursing practice related to prevention and health education, administration of new therapies, public health debates related to moral, ethical, legal, and social aspects of these new fields of knowledge. These fields are emerging, extremely complex, and ever-changing, with enormous implications for the detection, prevention, and treatment of human diseases. To define genetics is the study of the function and effect of single genes that are inherited by children from their parents. Genomics is the study of individual genes to understand the structure of the genome, including mapping of genes and sequencing the DNA, examining molecular mechanism, and researching the interplay among genetic, environmental, cultural, and psychosocial factors in disease. The Human Genome Project from 1988 to 2003 mapped all of the approximately 25,000 genes in human DNA and developed a conceptual vision related to 3 themes: genomes to biology, genomes to health, and genomes to society. The project found that all humans are 99.9% identical at the DNA level, and most of the 0.1% genetic variations are found within and not among populations. The project also noted the challenging ethical and moral issues that have both potential benefits and risks for individuals, families, communities, and nursing. DNA and its relationship to genomics and genetics. Research in genomics reveals that human disease comes from the collision between genetic variations and environmental factors integrating biological determinism within a social context. The challenges of genetic and DNA testing are tests are available to evaluate more than 1,600 genetic disorders, ranging from single gene disorders such as cystic fibrosis to more complex disorders such as diabetes. Taking a family history is a useful place to begin when considering a genetic connection and before the onset of testing. First used in the 1970s, the indications for DNA testing have expanded to prediction of genetic disorder development, population screening, clinical diagnosis confirmation, prenatal testing, and individualized medical treatment planning and application. As technology improves, DNA testing will be more accessible. Genetic testing decisions are personal, complex, and controversial, and can lead to dissonance in families. Nurses must respect individuals and family members' decision-making process and be well informed to provide accurate education to support appropriate decision-making. Current methods of testing do not detect all of the mutations that can occur in some diseases, including hereditary cancer syndrome related to genes. Therefore, if a mutation is detected, it does not confirm an absolute risk for cancer, only an increased risk requiring high-risk management. In contrast, if testing is negative, it does not mean that someone is not at risk. Current trends in genomics and genetics. The public is not fully aware of the importance of having a medical history, and many healthcare providers are not clear on how to interpret a client's health family history. Additionally, if clients are expected to make lifestyle changes based on information about genetic risk factors, the appropriate support and education should be available to those clients and families. Pharmaceutical companies are marketing genetic tests, advertising directly to public without access to appropriate counseling about implications and indications for such testing. Marketing on the internet complicates this matter further. Multifactorial diseases influenced by the environment, lifestyle, and other factors further influence disease risk, health conditions, and therapies used to treat the disease, especially in occupational health with lifetime occupational exposures. Of course, there's always ethical and legal considerations. All humans have a right to be deeply concerned about genetic science and its effect on their well-being. The 2009 Genetic Information Non-Discrimination Act, also known as GINA, addresses the ethical concerns associated with genetics and genomics and prohibits the improper use of genetic information in health insurance and in employment. Personalized healthcare, the U.S. Department of Health and Human Services, USDHHS, the healthcare initiative seeks to improve the safety, quality, and effectiveness of healthcare in the United States by using genomics in relation to drug treatment. Genomic competencies for the public health workforce. Knowledge of genetics and its applications to the health of individuals, families, and communities is critical for public health professionals. The Center for Disease Control and Prevention developed 7 sets of competencies for all public health professionals and genomic competencies for the public health workforce. The National Coalition of Health Professional Education and Genetics recommended at a minimum that healthcare professionals examine their practice competencies regularly related to genetics and genomics. Understand that health-related genetic information can have social and psychological implications for individuals and families, and know how and when to make a referral to a genetics professional. Incorporating genomics and genetics into public health nursing practice. Public health nursing has long been concerned with environmental or social determinants of health and disease, and has only recently become in genomic variations within populations to enable health promotion disease prevention programs to be specifically directed at susceptible individuals and families or at subgroups of the population based on their unique genomic risk profile. The International Council of Nurses and the American Nurses Association Code of Ethics both mandate the right of the public to seek and receive genomic health care that is non-discriminatory, confidential, private, and enables those served to make informed decisions. Similarly, the International Society of Nurses and Genetics advocates for basic and advanced practice nurses to deliver genetic nursing care through basic education identification of genetic risk factors, nursing interventions, referrals, health promotion education, and advanced nursing practice nurses can provide genetic counseling and case management. Initially published in 2006 and revised in 2009, the 2009 Consensus Panel on Genetic Genomic Nursing Competencies developed professional responsibility and professional practice domains for all registered nurses for nursing assessment, identification, referral, education, care and support, and outcome indicators. The future. Knowing which populations have genetic risk for various diseases will help nursing science to develop and apply public health interventions that will improve health outcomes and community well-being and reduce costs. Nurses will provide guidance on policy discussions and decisions to ensure confidentiality, provide protection against discrimination based on the genetic information, and regulate commercialized genetics products and services. Public health nurses must be well positioned to incorporate this new knowledge into practice, to be competent to obtain comprehensive family histories, to identify risks, assist with decision making, understanding results, and making referrals. Knowledge, skill, and abilities are integral for changing lifestyle behaviors and managing chronic disease. Future research can examine the interactions among genetic susceptibility, environment, and lifestyle, as well as their effect on susceptibility to chronic illness. Population-based research is interested in biobanks to collect and store data and biological samples from a large cohort of people, especially for common conditions that require large sample sizes. Nurses bring a biobehavioral perspective that includes an emphasis on prevention and health promotion for individuals families, and communities, and considerable expertise to genetic and genomic policy making groups.